So on the panel, we have Claude. I think by now people know him. Mark, are you there? Mark Ryan? Oh, Peter Ryan.
Peter Ryan.
Peter Ryan, yes.
Sorry, Peter, I was talking yesterday. Yesterday, I was talking to Mark. Alexandra, are you there?
Yes, I'm here.
Okay. Who else is there? Serge?
I'm here.
And Stephen?
Yep, I'm here.
So Stephen has, I think, a time limitation. I will go direct to the panel. So in the panel, I will ask questions to our panelists. So I will come to them, and then we would like to open it for the attendees so that we have some interaction. So the subject of panel, as you see, it's about European sovereignty in contact tracing. And let me just go through our panelists, and each of them get a very short time to introduce themselves. So Alexandra, ladies first.
Okay, my name is Alexandra Dmitrienko. I'm a professor at University of Würzburg. My area is secure software systems and platform security and privacy.
So Stephen.
Hi, I'm Stephen Farrell from Trinity College Dublin. Generally work on internet security and privacy, internet standards, things like that, and been looking at this problem for about the last 6 months or so.
Peter.
So I'm Peter Ryan. So I'm professor of applied security at the University of Luxembourg. I've been working in crypto information assurance for a good 30 years or something. A particular speciality of mine is looking at secure, verifiable voting systems, which I can see quite a lot of analogies with the issues here, which maybe we'll come back to later.
Yeah. Serge, please.
I'm Serge Vaudonnet, so I'm a professor at EPFL. I'm teaching cryptography. I've been there for 20 years, and I have a quite broad interest in cryptographic algorithms in general.
Okay, so I'm the moderator. I'm Sadeghi from TU Darmstadt, and my area is system security and applied cryptography. So let me go directly to the first warm-up question. That was mentioned by some questions in the chat as well. Do we really need digital contact tracing? Do you think it is useful? Oh, Claude, I forgot you, I think. Where are you?
Yeah, I'm here.
Oh, sorry, Claude. Maybe you also, sorry. You also introduce yourself.
Yeah, so I'm Claude Castellucci. I'm research director at INRIA, working on data privacy and security. And I was been working for the last 8 months on this Tous Anti-COVID application for the French government. But
okay,
I'm a researcher.
So my first question was, Claude, do we need digital contact tracing? You are working on a French app. Maybe you start with it.
Well, I mean, it's obviously yes. I mean, if we've been working on that for the last 8 months, is that I have some.
Why are you doing that?
Yeah, exactly. I have some hope that will be useful, and this is useful because for many reasons, right? I mean, it as we said is not going to solve the problem. It's just one tool among many different other tools. It's there to complement manual contact tracing, especially when you're like in public transportation or in a restaurant and you don't know the people. So for me, clearly, yes, I mean, it's not going to solve everything, but it's quite useful. And I think it's already shown that it's useful. I mean, there was some discussion earlier about the efficiency of the scheme. The main question, and we can discuss about it later, is how do you actually evaluate efficiency? So there was some number, but this is the question I wanted to ask to Nuria. She showed some numbers, and at the end, she showed that there was only 3 persons that were notified and end up being positive. My question is that even if you only notified 1 person and you manage to prevent 1 death, isn't it enough to justify the deployment of such a tool? I mean, how do you measure as the number of people that you're going to save? I mean, you see, this is very tricky. So to me, it's a technology that I'm not sure doesn't really hurt. There is no risk, at least for the French one. I don't see any we did a risk-benefit analysis, and clearly the risks are only on paper by some, I would say, activists. In reality, the risks are very minimum because of strong accountability, strong transparency, and there is some hope that there will be benefits. But
Okay.
let's see and wait. It's
Okay, Stephen, you analyzed these apps, and you had published your results. What do you think when Claude says that if there is transparency and there is no risk? What do you think? Do we need the digital contact tracing, given your analysis?
So I'm going to answer a slightly different question.
Okay.
If it worked, then it would be worth doing. It's not clear that it works, and if it doesn't work, it shouldn't be done. Would be the approach I would take. I don't think it's a zero cost or thing either. There are, if we aren't giving up something about privacy when we're doing this. So for example, if you look at Joel's paper, that it could be leveraged for other abuses. And it's only really worth doing this, I think, if it works. And I think we've gone about this backwards. We've seen lots of deployments where governments are saying, we're deploying this, it's going to save some lives. And they don't know that's true. It should have been piloted, it should have been deployed, it should have been treated like an experimental possible thing that might help. And then after we proved it worked, then we should have gone to deploy it. I mean, I think we've just done it backwards. That, I guess, is a typical computer science or industry, IT industry thing to do, is just roll it all out, and if it breaks, it's fine, we just stop. But I don't think that's correct. I think if governments are pushing and advertising in the way that's happened in lots of countries for entire populations to adopt applications running on only 2 operating systems, on so basically with essentially reinforcing the duopoly that exists, that has lots of bad consequences in other parts of the world, other parts of the IT ecosystem, then I think they have a responsibility to first demonstrate efficacy, and that has just been failed. So it's probably too late now, but I think the right thing to have done would be to propose this as an experiment, do some pilots. After it's shown to be worked, then try and spread it. So we did it backwards.
So Alexander, what do you say?
So to your question, if we think it is useful, of course, I think general understanding that it is, otherwise we wouldn't spend so much money in every country. As computer scientists, we also thought, at least at the beginning, that it is very useful. This is why we started working on this topic. We hope that we could contribute and help, prevent people being infected, saving lives. This is a very honorable thing to do, and we were excited about it. But of course, as we see at the moment, that it doesn't really work as it was supposed to work, and this often happens in real life. And at this moment, probably we shouldn't discuss like if it is worth or not, because so much money we already spent, but we have to see if we can somehow, based on lessons learned, if we can somehow change the direction, make the system better. Can we somehow, I don't know, put some additional technology on top to improve the system? Can we get rid of Google and Apple in the game? Is it actually feasible? So we know that even though different governments were talking to Google and Apple and trying to, push them to do something, for example, open interfaces, that they could build their open apps without relying on operating system-based services. It didn't work quite well. And I think this is like also more political question rather than technological question. And it seems that separate countries couldn't do that. They couldn't achieve a satisfactory result. Maybe if it would be decided at the EU level, maybe we would be more successful.
Okay, this is a good term, using EU. I jump to Serge to the next question. So assume that we need that, okay? Now, what happened to European technological and data sovereignty that all the politicians, I didn't want to have a politician here because they will not answer our question. But from scientific point of view, why couldn't we agree on a I mean, why at least not academia, who are actually in these advisor teams of governments, could not convince each other to have a European solution? Serge.
I think it was a plant at the very beginning. So when this PEPPT project was launched, it was, I think, so I don't know how it was running, but it was at least a European project trying to propose some European solution. But the plans were completely changed because a bunch of people decided that what they wanted to do was the right thing to do, and they made people sign a letter which kind of trashed all the plans from PEPPT, and later solutions they propose instead were not even respecting what they wrote in the letter. So I think it was a disaster from my viewpoint, but I think that we could have had some more consensual solution. Of course, we had to do it very quickly, but I think that we went too fast to accept a sovereignty loss. So by having these two companies playing the role of a referee in all this dispute and imposing a solution, so I think we have lost something.
Okay, so I would like to now give the stage to participants. Anybody has a question or wants to direct a question before we just proceed? Please raise your hand. This is a panel discussion. We want to, I know it is late, but it's not easy to get all these people at the same time in a virtual room. And Stephen has also a time limitation. He has to leave very soon. So please ask questions. No questions? Oh, come on, attendees. You must ask questions.
Yes, there's one.
Please, go on.
So here is Gordon Mühl speaking. So I'm not from academic. I was very glad that Professor Sadeghi invited me as well. So I'm the global CTO of Huawei. So we also deploy smartphones. Unfortunately, the Google network doesn't work on our, the Google stuff does not work on our new phones. So if you can free choose from a smartphone window, what should we provide you to solve that thing?
Well, use the French application.
Now, we built the smartphone, so if you're happy with it, so I can go back to the development and say, guys, please provide that to make it more useful for Europe.
So I don't know that that's the right way to approach it. I mean, the basic question being asked here for these phones is, can you detect distance and time reliably with Bluetooth? And the answer may be no. So I think the first step would be go back and find a better question to try and answer. Because, you know, we did a whole bunch of experiments, and if you have two people sitting on a metal park bench, the metal will affect the radio signal and you will get false negatives. There's a whole bunch of reasons why the proposition here is questionable. So I don't think we should be saying, I have a phone, therefore I need an app. We should be saying, what could be usefully done? And we never did that.
We have another question in the chat from Arkana Krishnan, how to start small-scale experiments.
Yeah, hi. I didn't know how to raise hands. I only see thumbs up and a wave. But my question was there was like many presenters mentioned that the best way right now would be, we should have started it earlier when these apps came up, but right now at least start with small scale experiments in university settings where you can incentivize participation. But is there, do you have some sort of a plan of the best way to approach this?
So I think, as Stefano suggested earlier, I mean, I think, you know, campus scale studies could have been done. I know in Ireland they did something sort of sensible, which was before they made the system live, they first deployed it with some of the local police, the traffic police. However, that wasn't the kind of a dense deployment. It was kind of very scattered, and it wasn't. And they did it too quickly, and I think they immediately moved into doing the full so-called production deployment and claiming that it was going to be all great and try to get the entire population to use it. I think we should have applied the scientific method, basically.
Okay, any other question? Alexei, did you ask your question?
Yeah, well, I had a question. You know, people in the computer science community here are doing a public service, very much like people in biotechnology are doing a public service through vaccines. So in terms of experiments, of course, somebody already said on the chat, there are protocols for vaccines, all the experimental protocols. The only serious experiment I know of was by UK on the island of Wight, right? And that convinced the UK government not to deploy the first version. But that's the only sort of real life experiment I know in the computer science community. Isn't this whole thing teaching us a lesson that we should be thinking about common protocols for informatics products, much in the way the biotechnology community has organized itself since 1970s? To, you know, through the World Health Organization and other such things, to come up with a common set of standards. Don't you think that all of this is a lesson for computer science?
Well,
Who wants to go for it?
Yeah, I can go. So first of all, I think just to answer the previous question about deploying it in different places, and that was explained very well by Stefano, you have a chicken and egg problem. You really need a lot of people to install it before actually seeing whether it's efficient or not. And then you have this, how do you evaluate efficiency? That's something else. So I'm not sure that Bluetooth does not work. Maybe some experiment and it works like a lot of the time, most of that. Maybe you can always find scenario, you're in the metro and you have a Faraday cage that won't work, but most of the time it works. It's not that you need a very accurate distance, you need proximity. And this is even more true now that we know that the virus spreads through clusters. But I agree that we should also test other technology. That's what we're doing. As I said, we are looking into QR codes for closed environment. So that would be like another alternative. And just to answer to Alexei, yeah, I think you're right. And this is one of my slides, you know, we need to work on what I call evaluation by design. It's nice to have privacy by design, but also we need to make sure that whenever we design a system, we integrate in the design all the necessary tools and data that are necessary to evaluate the system. And we usually don't do it because of the lack of time. It's a bit like security and privacy. That's something you do at the end if times allow. But you're right, we should really have a new maybe field of research to work on this privacy preserving evaluation by design. I agree.
Okay, sorry, I have to go to another question. Gang, could you please go on?
Yes, so this is Gang Pugh from University of Maryland here in the United States. And first I want to thank my friend Ahmad for inviting me, and then thanks for all the speakers. I mean, to do this very nice, I mean, presentation here. So I think many people mentioned about, in some sense, this is more or less a policy issue than a technical issue. And here back in the US, here actually we are doing much worse than you guys in Europe. And so, for example, here before the pandemic, whether people can, we can install, we can establish this spinning camera. And then that depends on different states. They have different state laws, and then people are saying this is going to invade their privacy. And I'm just wondering, I mean, the things from the experience you guys have learned here. So is there anything where you have any plan to share these things or to deliver this message to the European government, and also trying to, to share with the US government or with the US researchers here?
So who goes for it? What can we share with US government? I think it's the gang. This is if you ask me, it's a difficult question, because also in US, I know it because we work with San Diego, the local politicians, the state politicians, they don't want to have anything from outside US. Everything should be US centric. So, you know, America first, even if it is Trump, so to say, slogan, it is in many cases like this. And
yeah, and maybe in Europe it's the other way around, right? It's US first. And Europe.
In Europe is also America first. We take Google and Apple instead of own technology. That is easier.
Exactly.
So,
maybe one lesson that we learn is that the lobbying is very strong when you have something like that. Lobbying in Europe was very strong. I mean, this is what happened, right? I mean, in Germany, with the fact that they switched from one solution to the other one, it was just the effect of lobbying. A small group of people with very good connections managed to make 300 experts sign a letter, and most of these experts now start regretting it because they realize that they've been manipulated. And then they went to Brussels and they made a lot of noise. So something yet to realize is that sometimes it's not, not sometimes, often it's not the best technical solution that gets deployed, is the solution that are actually pushed by some lobbyists. And this is very important. And I think that our research community has also a huge responsibility in this decision, right? And I think it's an important lessons that we learn from this 8 months of.
I have now a question that I want to direct to Peter. Stefano, he mentioned in his talk that actually he doesn't see why should be a big breach, but he also understands the concern of people who don't trust these giant data collectors. Now, if we accept that these guys can come into our public health system, let's say, because even if the data that they are collecting is kind of privacy preserving, but who actually, Peter, you have been working, as you said, on voting system for many, many years. And what's your take? Can we also trust them with voting, mobile voting system for parliaments? What do you say? If we trust them, if we say, they will not be such a breach by these corporates, they have too much to lose. What do you say?
Well, I personally wouldn't want to put elections in the hands of Google and Apple and Microsoft and so forth. And actually, I suspect they wouldn't terribly want to take it into their hands. Certainly, the position of Microsoft for a long time was they didn't want to touch voting systems with a barge pole. That has shifted a bit more recently. I mean, my view is that voting systems should be such that we don't really have to trust anyone, or in some sense, the trust is moved onto the electorate generally. So we have things like Ron Rivest's notion of software independence, or these notions of end-to-end verifiable systems. So, I mean, the goal very much for me and other people who've been working in this space is to try and minimize the need to trust, whoever's running the technology, and try and remove trust in code, software. So I'm not quite sure that's quite answering your question. I'm not sure the situation is quite analogous.
I'm just maybe comparing banana to apples, but
there are some analogies, but it's not. But then there are significant differences, I think.
Of course. But as you saw, we had talks about by Rosario that you actually can use these systems for voter suppression. This is the general idea, yeah. But these are kind of connected. A technology given to a big giant data set. So I think Claude wants to say something. Claude,
yeah, I mean, I think this trust issue, it's important. I mean, whether or not you trust Google and Apple, it's your own decision. We do not trust. I mean, especially you see that Google is going into the health insurance business, They are not doing that for the good of humanity, right? Despite what they say, they are not deploying this gun for the good of humanity. So you have this trust issue that is important. But the thing that is actually bothering me even more is that they are preventing health authority to get the data, right? They're getting the data for themselves, and they are basically controlling what data the health authority can obtain, which is not acceptable in a democracy, right? You cannot, so you have two issues, the trust, and they are the one who will say, okay, no, France, you're not going to get this data because we think it's bad. You see? So there is this sovereignty, it's about deciding what kind of data you need and what kind of data is necessary. It should not be private companies, especially companies that are not in the country, that decides this type of things, right? That's very important.
Okay, Alexandra, you want to say something?
Right. I wanted to add that somehow we came to this situation where Google and Apple are two companies that actually have smartphone technology in their hands. So we don't have much concurrence there. And it happens now with contact tracing. And ironically, I won't be much surprised if it happens next to voting or some other critical systems. And as our current experience shows, governments, public, somehow they are okay with that. They don't see the threat. They say, okay, we, you know, when I speak to normal people, they say, but look, I don't care about like privacy settings, about sharing my location with Google servers. I already use Google Map, for example. I use other Google services. But the difference is that you can install other, you know, provider for app or other app instead of Google app, or share your data with other providers. But in this particular case, when we don't have any choice anymore, this is completely different story. And somehow, step by step, we give away this you know, this diversity. So now we don't have much choice, and we see it clearly with contact tracing. And maybe you are right, and it is going, the voting systems are going to be the next.
Yes, I think in US it makes sense because they have this very strange election system. They may also do voter suppression wherever they could, depending on the party, of course. In Europe, politicians may not be willing to do that with voting because their position and their will be in danger, so to say. They risk their own stuff because the system can go wrong. Pandemic is concerning other people. So maybe we go to the next question, or before we go to the next question, we would like to ask our attendees to say something if they want to go for this. Do they trust? They already trust many services. Would they trust also in future voting systems to be on their phone? Anyone who wants to get involved?
I'll have a go.
Oh, Stephen Marsh, please go on.
Sure. So I just put this comment in the chat as well. I mean, when we say we don't trust them with, say, voting technology, exactly what are we talking about? They are undoubtedly capable of making technology which will allow us to vote. There's not a question there. The question is, do we trust them with the data that they're going to get, right?
Exactly.
So, you know, we need to ask the right questions before we get there. And the same question kind of applies to this contact tracing. I think that they can probably do it better than anybody else. And the question then becomes, well, given the, well, if we accept that it does work, and there's no guarantee that that's true, what is it that we can do to make sure that the things that we don't trust them with, which is probably our data, to protect it?
So I'm not sure. Again, I think you said yourself we have to be careful with the questions. I don't think that question works either, because it assumes there is a solution that does work. So I think it's definitely true that Google and Apple are absolutely needed to be involved in a strong way once you come to dealing with the Bluetooth radios and that across the range of particularly Android handsets. There's thousands of different handsets in Android. The antennas are all different, the radios are all different, the chipsets are different. You do need those players involved. The question, I think, comes back to one that was mentioned earlier about governance, is how do you properly divide up the various players in this contact tracing system to give them the right power that they should have? As an example of that, Google typically, they ship new updates to Google Play services, which is how they do their part of the GAIN implementation. And that happens invisibly. And users don't know that they've gotten an update. And those updates will affect the sensitivity of the apps as deployed. So Google could update something and you can start generating new false positives or false negatives. And that's absolutely out of the control of any health authority. And that's wrong. So again, I think we have to, there's a level of detail here, and assuming that this stuff actually works is not a safe assumption in my opinion.
Okay, Peter, you wanted to say something, Peter? So the questions are always on the slide. So it was indeed about the trustworthiness of these companies. Please, Peter, go on.
Yes, well, I mean, I want to jump in with one point. We seem to be slightly slipping when we start to talk about voting into talking about online voting and mobile voting from your mobile and so on. And I mean, people have suggested this, but I mean, I think the view certainly of myself and many other experts like, say, Ron Rivest, is that that is an extraordinarily dangerous step to take. We really do not have the solutions and the technologies to do this in a safe way, whether it has anything to do with Google or Apple or whatever, just over the internet. The fundamental insecurities of the internet and of people's devices means that we just cannot do this safely. I mean, maybe we can, to elect the dean in Louvain-la-Neuve or the president of the student university or union. But for president of the US, this is not somewhere we want to go now or anytime soon.
Yeah, no,
so,
I just wanted to have this controversial question because I think if we trust them, because it was it was mentioned, okay, they can do the technology, we should trust them. We don't think that they are going to bad things. This argument is very dangerous, and it is done by politicians very often. And I'm just worrying about, okay, now it's public health system, next time we'll be voting. What do we say to that? So this was actually the reason why I asked question. So I think Claude, Alexander, and Serge, did you want to say something?
Oh, yes. So
yes, please go on, because your hand was first. Yeah.
Oh,
sorry.
Your hand was first. You wanted to say something.
Serge, your turn.
Okay. Oh, sorry. Yeah, I don't think that that people are malicious and that these giants are necessarily malicious, but they follow their interest. And now that we have this beautiful GAN system, which is implemented everywhere, which can be able to identify people who have been in contact with other people who satisfy some criteria. Now, if I was Google, I would be able to sell to some companies some target advertisement for people who have been in contact with people who are already customers of this company. So I think this system can be easily deviated. So they can run their own server and have their own notification and alert, which is deserving a completely different purpose. It's just that this data will be exploited in different manner, and I'm not sure we want to be part of it.
Okay, this is so that actually you are answering my next question, which is speculative question. Why are these companies want to in a kind of dominant way help us, so to say? They say that they want to help the humanity against the pandemic, and indeed there are many other commercial interests seems to be inside this this bin of these guys. So Alexander, do you want to say something? Otherwise, I go to the attendees.
Okay, I can say
try to help us.
something.
Sorry.
I think,
Oh,
you know,
sorry. Go on.
Yeah, normal people work also for Google and Apple, and I can just tell that I was in discussion with some members of development teams for example, in Google. And those people were really, proud of doing this work, and they also believe that they are doing good things. So it's not necessarily, you don't necessarily need to put this sarcastic note in dominant help. I think they might have at the beginning, genuine intentions. They wanted to do it, as best as they could. They were very proud that they could do it extremely fast, and they could really achieve it. And they solved a number of issues like interoperability issues and scalability problems and. But they somehow forget to look into those, trust problems and. So this is like exactly the issue which would be from their perspective, so it would be somehow beneficial to forget to discuss those issues from their point of view.
Okay, Claude.
Yeah, I mean, just to answer your question, they are not trying to help us. I mean, I'll give you the example for the French application. They did everything not to help us. So they are helping you as long as you use their system. But if you try to do something else, they won't help you. The other comment is following Serge comment. I agree. I mean, Google and Apple, they have like patents on tracking people in stores. So for them, it was the perfect experiment to optimize their tools. So most likely, you will find the same tools in a different setting, commercial setting. And the third comment is that you said it seems like from everybody that we didn't have the choice. We had to go to Google and Apple. I'm sorry, we didn't have to. If Europe was strong, if we were all, fighting together against Apple and Google, they will have done what Europe would have asked for. Okay, we didn't ask anything to Huawei. We didn't ask anything to the other one. So why Google and Apple are so important that we should ask them?
I completely agree.
It shows the failure of Europe and the weakness of Europe. I think the initial project with Germany and France was a great opportunity to develop something for Europe with the help of other countries. And because of a small group of lobbyists and activists, it didn't work. But it's how it works. It only shows one thing, is that Europe does not work today.
I think one thing that we should first do in Europe is to ask them to pay their taxes. They still didn't pay it. So anyway, is there any? I saw a question, but the person just left. Maybe we just ignored the person. So it's I'm sorry about that. I don't see any question. Any question from the attendees? Please don't be shy. So there is no question. Then let me go to the next question. And this is something that maybe is also important in for example, US. Who has the task of protecting the health of the population? American data monopolists, for example, in this case, or the government? Could we trust the government in the same manner that we say, okay, we don't trust these giants, but we trust government? Could we trust the government? Is that not a substantial question? Because the same question many Americans ask themselves. Who wants to go for it?
I mean, if you don't trust the government for the health, I mean, who are you going to trust, right? I mean, if you don't trust the health authority to manage the contact tracing app, you have other more serious problem, right? I mean, who else? So come on, this is like, that just doesn't make sense, right? For this type of application, it's clear that the best partners are the health authority, because if you don't trust them to run the contact tracing, you are in deep, you know what I mean, problem.
Yeah, I'm just asking because some people, I'm just asking because we have thousands of people, even in Germany, they're not big, but they are there, who are going to Berlin and demonstrate against government because they don't trust the government. They think that government is making all these things. So, Stephen, you were.
Yes, I personally, I think there's a valid argument to say that you might trust the government for protecting the health of the population, but I absolutely would not trust the Irish health authorities to write an app well. That's a different set of skills. And indeed, if you look at the Irish app, they hired a company to do it who are, you know, technically sound company, but that company applied the software engineering practices they normally use for commercial apps for playing bingo or something. And they apply that same mechanism, which means that there's a bunch of kind of auth tokens used to do authorization when it's not needed, which kind of act like a super cookie. So I would not trust the health authorities to write apps well necessarily, although I would trust them with looking after public health.
It doesn't make sense. I mean, I'm sorry, but it's not the health authority that are developing the apps. Those are big companies in Germany or in France. The health authority are just operating the service. They are the one that get access to the data. They are not developing it. I mean, of course, it would not make sense to ask the French health authority to develop an app. They don't even know what an app is. So the idea is that you trust the health authority to manage the system, but of course, the development is done by companies whose job is actually to develop it. Research center whose work is to design systems. So it's a governance.
When we looked at a range of apps across different countries, that was highly variable as to which were done well and which were done less well. None of them were terrible, but there was a lot of variability in terms of whether they open sourced, in terms of whether they had other data that they were leaking, in terms of whether they, there was just a lot of variability. It's not clear that a lot of those health authorities knew how to contract with some company to do a good job.
Okay, Serge, what do you say? In Switzerland, everybody trusts Swiss government, at least. At least this is their image.
Not really, but okay. So, in my opinion, so this task should be in the hand of the government. So, problem is that sometimes government does some stupidities, but when the government does stupidities, so people go to demonstrate in the streets, and that's normal. But if it is in the hand of some companies, so it's people cannot go in the street to demonstrate against companies. It doesn't work this way. Now, for developing an app, the health authority has probably, so they have learned recently what was an app, but at least there should be a competition of proposals by several companies. So there should be, in normal circumstances, there should be a public call for
this was in Italy.
Yeah,
this was in Italy.
In Switzerland, it didn't happen. So in
in Germany as well.
Government decided those people are in charge of developing an app. It will be run by the health authority, and there were no public discussion about it.
Okay, so I have then the next question, because I don't see any hand raised. If there is any question from the attendees, please chime in and ask the question. So one question that Peter, please.
Well, just to follow up there, I mean, one comment is we're getting echoes.
Yeah, you get echo. Go on.
Is it all right now?
Yeah, it's good.
I mean, it depends who you trust to do what. And again, I mean, to return to the voting analogy, I would say there's someone who develops the system. Let's say we're talking about a computer-assisted voting system, not necessarily internet, just maybe with voting machines or tallying machines. So, I mean, one thing is who develops the software and the technology for that, and the other is who runs the system. And so in that kind of situation, I would expect that some kind of IT company, ideally perhaps guided by academics who provide designs for, say, verifiable evidence-based protocols for voting, so the IT companies would develop that. But then I would hope that, it's election authority, election officials and so on who would actually run the elections themselves. And similarly for healthcare, developing an app is clearly something which some kind of IT specialist has to do.
Yeah.
But then who actually gathers the data, processes the data, notifies people, then I would say that's the health authority. And also the health authority is not the same as the government necessarily.
Yeah, this is indeed done in some countries, at least I think in France it's done, in Germany it is done. Yeah. But of course it is all based on the core technology coming from Google and Apple. So I want to have two other questions before we end the panel, because people are getting tired and it's late, I know. What happens if actually Apple and Google stop supporting this API? Because there were some, Apple said, okay, if the pandemic is over, we just throw it out, which is I don't believe. I think they have other, as Serge said, they have other usage for it. But what happens? I mean, what do these countries do then? What does German government would do? I mean, what would be your input to that? Who wants to go for it? Serge.
I think there is no B plan. So if they stop supporting this system, so we will look like on a picture, like zombies with no infrastructure. But maybe we should also think about what is happening right now when they are supporting this API, because there is currently a digital divide. So we have people who use these systems, who are happy to use this system maybe, and people who cannot use this system and who wanted to use this system, but they cannot because either they don't have smartphone, or they have a Chinese smartphone, or they have a too old smartphone, or whatever. And currently, you already have some zombies around who are out of the system. And probably
exactly.
you would just look like like all of them if they stop using this system.
Okay, and there is another question. So there are the kind of data is already collected, and of course we don't have any idea about it. What happens to that data if they stop supporting it? But what happens if they even start, because there were discussions about that or rumors that they want to start their own app. So Google and Apple provide this app and give it to one authority, approved authority in each country. So they don't need any apps from the, so to say, local companies, but they say, we have this app, if you want to use it, but we just approve it for one government, so to say.
I don't think they will ever do that because of liability issues. So they basically maybe always ask the country to write 1 or 2 lines of code. I mean, the apps are very small, right? In most of the country, if you use GAN, it's just for liability. So they are not responsible. It's the country that writes the app that is liable for the app. So I doubt that they will deploy the.
So you think this would be no go for them? It's not incentivized.
I don't think so. I mean, you never know. I mean, they might use it for, as I said, in stores for tracking, marketing, other issues, but yeah. I don't think they will do that for medical type of application.
Okay.
At least at the moment.
So any other one wants to have an input on that? Then I go to the next question.
Just for your first question, if they stop supporting the API, we'll be happy to share our application with the rest of Europe.
Okay, I think Stephen, are you still there? No, I think he's gone because he has a time restriction. So now another question that I was asked by many people whenever we talk to them is, to what extent are sensitive information from GAN-based app users collected and shared? So are there any evidences out there? I mean, what I mean is that this was I don't know if it's not only Google and Apple who are going to share this data, but also so the external adversaries could access this data and share it. Is there any evidence out there, or is there any incentives to do that?
Maybe I can say something about it. So all the app developers of different countries, they always write in the app introduction, we are not collecting anything, we are very privacy preserving, we are using technology which is privacy preserving. But when you look into more details, for example, how it is implemented on Android operating system, it suddenly appears that to make the app possible to run, you have to enable gathering location information in phone settings. And once enabled, it enables Google to collect this location information for different purposes, like, for improving location tracking, for advertisements, for improving their services. And if you don't enable this option, basically you cannot use the app, and it also doesn't give any other choice to the user unless he is going to go and buy iPhone, which doesn't have this problem. I believe not many users would do so. And there was also, there were debates if this is actually acceptable, and actually Google needs to somehow change this. And the different governments also protested against it, but nothing happened since then.
So, but you had a discussion with the New York Times on that. Did they change that afterwards?
No, they didn't. So they, after New York Times article was published, they say they are going to change it, but since then nothing happened.
Okay.
At least it is not fixed today.
So this is interesting because I thought they changed that. Okay.
And another thing is that the app itself, it also does require user to grant location permissions. The app itself doesn't use it, but still the permission should be given, right? And then of course, this is the question of like, you need to trust somehow that the app doesn't do anything. So you need to publish code, you need to make it transparent. You have to make sure that the code is published is actually the code which is actually running.
Okay, so let me come to, because we are running a bit late and that's near to the end of the panel discussion. So what is actually with privacy preserving digital contact tracing? The Chinese, the Singaporeans, the Koreans, they don't have all these problems that we have. They used it and they were very, very successful. So now I'm just going to the other extreme. Is privacy preserving digital contact tracing? It was also mentioned by a number of speakers that you can think about it either like this or either or another way. Is that effective? Is privacy preserving contact tracing effective at all? Because currently we see all of these apps that are based on Google and Apple approach. They are not really effective. We don't know how you measure their effectiveness in general, because they always say, of course we don't know because it is privacy preserving. As I said, there is no feedback possibility. Now, what do you say? If we take the Korean approach, we may have all the information about the people, social graph or whatever, but we know who is touching whom, yeah? Or is there any trade-off? Who wants to jump in?
Yeah, I can say that we don't know if they are effective today or not, because we don't have the data, but the general belief is that the acceptance or deployment is too low to show real effectiveness. And maybe the way to go is indeed maybe using some test platforms like university campuses. But for example, at our university, what happens, we are enrolling other app, like completely privacy unpreserving app, which gets everything. It is for students. It collects information about student IDs because students are registered. And then we are tracing like which student went to which lecture at what time. So we have kind of local tracing. And yeah, the question is, given that there is a possibility to do so, not in privacy preserving manner, why would some university campus be interested in deployment of privacy preserving technology?
So Claude, go on.
Yeah, so I mean, I guess the question is that could we do better without privacy, right? And it depends what you mean by privacy preserving. I think it was Serge who says that whenever you have privacy preserving in the title, it doesn't look good. But it depends whether privacy means taking away data to solve the problem, like with the Google and Apple solution, or does it mean to build some trust relationship with the institution that needs this data to do their job? We think that that's the second definition that should be used. Of course, there is always some trade-off. If we had access to location, if we had access to many things, we could identify clusters more easily. This is what they do in Asia. There's a lot more you could do, but are we willing to do that? So it's more like an ethical issue or acceptance issue. But the more data you have, of course, the better you could actually solve the problem, but the higher the risk will be. So we often give the example, I think it's Korea or Asian countries that are doing well because they actually gather much more information. I think it's not only because of the data that they collect. I think it's because most of people respect, we say, the rules. Like one of the biggest problem at the moment in France is that when people get a message to isolate, they won't isolate themselves just because either they don't care or because they need to go to work. There is no really social pressure to isolate. So it's not enough to have an app. You need to have the whole chain. And there are many different ways, different part of the chain that could make the whole system not work as efficiently as it should be. So it's a very complex problem, and the answer, I think, is also complex.
Okay, so I have now, anybody else, anyone from the audience, virtual audience, want to say or ask questions?
There is a question from the chat. Is there any GPS-based COVID app in Europe? Did you hear the question?
Is there any question in the chat?
I think there was one in Norway. No.
Yes. The question is there any GPS-based COVID app in Europe?
The Norwegian one and the Icelandic ones are
yes,
at least
Iceland
using GPS.
And Norwegian. Yes. Just a second. I have here a camera problem.
No, you're fine. I can see you.
You're fine.
We see you, yeah.
Okay, so yes, there are indeed. You can, I think you can also look at it at our webpage. There is a list of all kind of, I don't know if Iceland is listed. There is a list of all these apps. Okay, I come now to the end of the panel discussion on our closing remarks. First of all, I want to thank you all for being on this panel and so late, especially for those participants who are here so late. And I'm sure that some of them are at home with kids and pets and whatever. So, and going through all these virtual talks is not always easy. You need to focus and be concentrated. Now, as a last, so to say, last statement of every of the panel participants, I start with Alexandra to ask her, what do you think is important for future when we really want to use technology against pandemic?
I think it is always good to have alternatives, and we could have different ways to achieve it through, for example, through call for different proposals, evaluation, maybe developing some standards, testing, etc.
That's it? You are very short. Okay, Claude.
Closing remark.
So,
don't tell me use the French application. Don't tell me. What is the future?
So my closing remark would be that I'm very, very proud of what we did. And I'm very happy that we got this strong support from the French government, because without it, I think we would have moved to the wrong side of the system. We would have been using Google Apple. So I say I'm proud, but I'm very sad for Europe. I think it was a great opportunity for Europe to design a system that would have been much better, interoperable, and my call is just to try to fix it for the next pandemic. So we work very hard in a short time, like in 8 months. There were some decisions that had to be made quickly. It was not optimal for researchers because usually we work on longer term. Yeah. But maybe it's time to call for projects in order to prepare for the next pandemic, whenever it will be, and start to learn from all what we learned during this last month.
Okay. Please, Mark, what is your vision of future in pandemic, using technology against pandemic? What would be your vision?
When you say Mark, you mean Peter, right?
Oh, sorry, Peter. I'm really sorry. Oh,
I'm
tired. I'm
getting
tired.
used to it, yeah. Well, I think the key point I wanted to make, I think the key message for me is that we really need to get clear here, what are the requirements? We really need to come to some sort of consensus with the stakeholders. As I think various people have observed, there's been a tendency for technologists to approach the problem with a very technology view. We think we know what people want, and we think we know how, crypto or whatever can deliver that. And quite often we end up falling into the trap. I mean, in the UK, there's been famous instances of big IT, for example, the health, digitization of health, that collapsed in a heap because they failed to talk to GPs and so on about what was really needed. So I think for me, the key message here is we need to understand what really is required here, and we have to explore other technologies. I mean, BT may not actually be the technology that we really need here. We need to look at other options to achieve those requirements. And I think that's the key message for me.
Thanks. So, Serge?
So what I would like to say to conclude is that maybe the key issues in all this technology, as some speaker mentioned, like Nuria and Stefano as well, is trust. So we need people to trust. And as a scientific community, I think we have a big problem now because I think there is more and more mistrust. And this is because we have been too fast. People have bypassed the cycles of scientific communication. Communication were heavily biased. There were lots of alternate truths revealed. And I think that we have to be very careful with the scientific communication and to think about the ethics in communication quite a lot. There were lots of conflict of interest also as well. And we have to be really careful to have better communication, to strengthen trust.
That's another topic that we need to discuss with many colleagues. Where is the scientific ethics? We had already this ethics by this big letter. And then, as you said, we forgot what was in that letter. So anyway, thanks a lot for being here, for spending your time. Especially, I want to thank Peter Ryan. I don't call you Mark anymore. I will write it. I will tattoo it here. So, because Mark and I are so good friends, we always talk to each other. So I just mixed up. But
then I will call you Mark.
Yes, you can call me Mark. But thanks a lot, Peter, for a short notice participation. And thanks a lot to our attendees. We had actually constantly 100 attendees. We had more than 170 registration, but I organized so many events. I know that half of them, they don't come or they come and go. So I don't know what else we can do for our attendees who were so patient because they were kind of passive. I will ask all the speakers, and I hope that I get their agreement whether or not they share their slides, because this question came many times. And I hope that they are willing to share it. So we will put it on a web page, or every speaker, if they are interested, they can put it on their web page. And we are put it on this event web page that everybody can download the slides. That's it. Thank you very much again for your time and for attending this web seminar. We will come, hopefully we will have another one, but with a different message, maybe more, how do you say, comforting message than what we have now. And then I see Gang is there. Gang, we are going to share with you everything we have. We need to help America. You are currently getting screwed in US. Okay, so thanks. And this is the closing remark. Anyone of you want to say something? If not, we just say bye-bye, and I hope that we can see each other one day physically and can do some hugging. I don't know, whatever you want.
Many thanks
Thank
to
you very
Ahmad
much.
and
Thanks a lot.
organizers.
Thanks for the
Thanks a lot.
invitation. Bye-bye.
Thank you.
Bye.
Great conference.
Bye.
Thank you.
Take care. Stay healthy.
You
Thank
too.
you.
You too.
I stop barking.
Oh, there is one question.
No, it continues.
Okay, bye. No, no. Oh, there is a dog somewhere. Okay, bye.
Thank you very much, Ahmad.
Thank
Very
you.
nice seeing you here.
Thanks. Bye.